Low-level laser therapy is one of the newer treatments we have for getting nerves to heal and repair. With that, the low-level laser sends specific wavelengths inside the tissue to cause actions. Some of the actions that happen are inflammation gets shut off. So inflammation activates the pain nerves to make them more painful, sending increased signals, which makes you more miserable. If we stop the inflammation from happening, those pain nerves are sending less signals. It also increases blood flow. So by causing vasodilation or increased blood flow to the tissue, those nerves can have more nutrients for repair. Laser therapy stimulates internal mechanisms of repair and regeneration to repair the axon or the nerve, and it also increases the mitochondrial production or ATP production, which is the energy those nerves use for repair and regeneration. That combination of driving repair, regeneration, increased energy, and shutting off that painful inflammation helps nerves start to heal, start to recover, and reduce your neuropathy symptoms.